name is Rachel and I'm a staff nurse from internal medicine. You are now watching this video as you will soon be going for surgery to remove your gallbladder. The procedure is known as laparoscopic cholecystectomy. In this video, we will learn about the procedure, laparoscopic cholecystectomy, life after cholecystectomy, how to care for your T-tube and your drainage bag, and when you should come back to the hospital. First, Dr. Yang, a surgeon from internal medicine, will provide information on the procedure that you will be going for.
Hi, I'm Dr. Yang from the Department of Internal Medicine. Cholecystectomy is a common surgery. It is relatively safe with little complication. Now, let me tell you more about this procedure and some of the medical management that you will receive after the surgery. Cholecystectomy is a surgical removal of gallbladder. It is a common treatment for symptomatic gallstone and other gallbladder conditions. So, this is where our gallbladder is. Laparoscopy is the most common type of operation to remove your gallbladder. It involves using a tiny camera and a surgical instrument that are inserted through a small cut in your abdomen. If it is suspected that stone may be in a common bile duct, the surgeon will place a T-tube in a common bile duct. A T-tube is a catheter used to explore and drain common bile duct. The tube may be left in place and an X-ray may be done 7 or 8 days after the surgery. If more stones are found, the radiologist can remove them without you going back to the surgery. During the operation, you will be put under general anesthesia, so you may experience difficulty with memory or feeling more fatigued for 2 to 3 days. You shouldn't drive, drink alcohol, or make any big decision for at least 2 days. You should have no activity restriction unless the umbilical incision was particularly large. Then, limit heavy lifting for a few weeks is advisable. Most of our patients are able to return to work within 1 week. All surgery comes with complications. One of the most common complications of this surgery is post-cholecystectomy syndrome. It is the persistent abdominal pain, diarrhea, indigestion, and jaundice that recur and persist after the operation. Other complications include wound infection and deep vein thrombosis. They are preventable, and the nurse will further explain how to avoid these complications. It is very rare that laparoscopic instrument may injure the bile duct or even the surrounding tissue, such as intestine, bowel, and blood vessels. It may be possible to repair any injury straight away after the operation. You may also be prescribed with medication to relieve pain, prevent infection and side effects such as nausea or constipation, as well as dissolved gallstone. You will come back to the clinic for follow-up appointment 2 to 4 weeks after your operation.
Hello, I'm Nurse Jyoti and I specialize in perioperative care for my patients. I will be sharing with you more about what will happen immediately after your operation and also about the major changes that you will be experiencing after your gallbladder has been removed. You will probably be able to get back to normal activities within a week's time, including driving, walking up the stairs, light lifting, and work. Activity is dependent on how you feel. Walking is encouraged. You can remove the dressings and shower the day after the operation. In general, recovery should be progressive once you are discharged to go home. Most patients are fully recovered and may go back to work after 7 to 10 days. Often, this depends on the nature of your job, since patients who perform manual labor or heavy lifting may require 2 to 4 weeks of recovery. On the evening of your discharge, it is advisable to eat light, plain foods, as greasy or spicy foods may cause indigestion at this early stage of recovery. However, there are no dietary restrictions after your operation. You may resume your normal diet. Some people may find in the long term that eating very fatty foods still produces some discomfort, in which case these foods should be avoided. After the operation, your bowel habits may change. For instance, some people may actually find themselves experiencing constipation. This can be due to the anesthetic or the painkillers that you may be taking. Hence, drink lots of fluids to prevent constipation. If your bowel still doesn't open within 3 days after your operation, please do visit the general practitioner or the pharmacist who can prescribe a suitable laxative for you. Other people may realize that they need to open their bowels more frequently and that their motions are looser than normal. This is due to the gallbladder being removed and will usually settle within a few weeks. If it does not settle within a few weeks, you may take an over-the-counter anti-diarrhea tablet. For this case, your general practitioner or pharmacist should be able to advise you. You should refer back to the hospital when you experience pain that is not relieved by medication, fever of more than 39 degrees Celsius, persistent nausea and vomiting 3 days after surgery, chills, persistent cough or shortness of breath, swelling, redness, bleeding or bad-smelling drainage from the wound site, unable to eat or drink, swelling of abdomen, or no bowel movement for 4 days. However, please be rest assured that we will only discharge you to go home if your condition has stabilized and you no longer suffer from the side effects of general anesthesia.
Hi, I'm Nurse Tzeling, and I'll be telling you more about your T-tube and the drainage bag which you might be discharged with, and provide you with more information on how to take care of the T-tube and the drainage bag when you are at home.
Generally, don't sleep on the same side as the tube. Secure the tube and bag inside your clothing. This will prevent the tube from being pulled out. Tape plastic wrap over the bandage and tube side when you shower. Most T-tubes are not connected to a drainage bag when you are discharged and are therefore closed. When tubes are closed, it is recommended you flush them once or twice daily with 10 ml sterile saline. This is a demonstration on how you should flush your closed T-tube. First, we draw 10 ml of normal saline with a syringe. Next, clean the cap with an alcohol swab and remove the cap. Then, inject the saline. Finally, clean the opening and replace the cap. Remember to clean the cap again. Should you require any further assistance, feel free to contact the hospital.
However, if you have been discharged with a drainage bag that is attached to your T-tube, do remember to empty your drainage bag at least twice a day or more often if needed.
First, remove the closure at the bottom of the bag. Next, drain the fluid into a measuring cup. Lastly, replace the closure on the bottom of the bag. Do remember to record the amount of fluid each time you empty the bag. You will share this information with your doctor on your next visit. Firstly, wash your hands. Next, remove the old bandage. After that, wet a cotton swab and clean around the incision and the tube side. Use normal saline solution or hydrogen peroxide. However, it is also acceptable to clean the skin around the T-tube with soapy water. Then put a new bandage on the incision and tube side. Make the bandage large enough to cover the whole incision area. Lastly, tape the bandage in place. You can refer back to the hospital if you have any of the following: pain that becomes worse, especially in the right upper portion of your abdomen, nausea or vomiting, fever above 38.5 degrees Celsius or chills, swelling or fluid around the tube, new redness or warmth around the incision or new fluid draining from the incision, an incision that does not heal after 3 to 5 days, or stitches that become infected or loose, or you are experiencing a foul smell from the incision site, drainage that changes color from light pink to dark red, or if your tube falls out.
We have now reached the end of the video. I hope that you are feeling more prepared to embrace the changes that you may face after the surgery. However, please feel free to approach the nurses and doctors if you have any questions during your hospital stay before and after the surgery. We will be more than happy to help answer them. Wishing you a smooth surgery and thank you for watching.